Portugal is writing a new chapter in healthcare. It's a story about equity, about justice, about recognizing the humanity in every citizen. The country is undertaking a bold reform, integrating its prison health services into the National Health Service. This is a powerful statement. It says that everyone, regardless of their circumstances, deserves access to quality healthcare. For too long, prison healthcare systems around the world have existed in the shadows. They've been isolated, underfunded, and often neglected. This has created a two-tiered system where the health of incarcerated individuals is compromised. Portugal is taking a stand against this injustice. They are bridging the gap, ensuring that people in prison have the same access to healthcare as those outside prison walls. This reform is not just about improving the health of incarcerated individuals. It's about strengthening the fabric of Portuguese society as a whole. When we invest in the well-being of all our citizens, we create a healthier, safer, and more just society for everyone. Portugal is paving the way for a future where healthcare is truly a right, not a privilege. This is not just a Portuguese story. It's a story that resonates around the world. It's a story that calls on us to examine our own systems, to challenge the status quo, and to demand better for those who have been marginalized and left behind. Portugal is showing us what's possible when we choose compassion over indifference, when we choose equity over disparity. The world is watching, and the message is clear. Healthcare is a human right, and it's time for all of us to step up and make that right a reality. For years, Portugal's prison healthcare operated separately from the national system. This separation had serious consequences. It led to significant discrepancies in the quality of care provided to incarcerated individuals compared to the general population. Imagine being denied basic medical care simply because of your incarcerated status. This was the harsh reality for many in Portugal. The independent jail health system struggled. Resources were scarce, facilities were often outdated, and there was a severe shortage of qualified medical professionals willing to work within the system. This resulted in delayed diagnoses, inadequate treatment, and a lack of access to specialized care. The consequences were dire, with preventable health complications worsening and chronic conditions spiraling out of control. This system was not only detrimental to the health of incarcerated individuals, it also posed a significant public health risk. When individuals are released from prison with untreated conditions, those conditions don't simply disappear. They can spread, impacting families, communities, and the broader public health system. Portugal recognized the urgent need for change. This recognition wasn't born from judgment, but from a place of understanding, compassion, and a commitment to social justice. They saw a system that was failing its most vulnerable citizens, and they knew they had to act. The decision to integrate prison health services into the NHS was a bold step towards righting historical wrongs. It was a commitment to creating a more equitable and just healthcare system for all. Section 4. Modernizing prison healthcare. In recent years, Portugal has taken significant steps to improve healthcare within its prison system. The focus has been on providing comprehensive medical services that address both physical and mental health needs. By integrating modern healthcare practices, the system aims to ensure that inmates receive the same quality of care as the general population. This approach not only benefits the individuals in custody, but also contributes to public health as a whole. Section 5. Upholding human rights. Central to Portugal's prison health reform is the commitment to upholding human rights. This means respecting the dignity and worth of every inmate, regardless of their circumstances. By prioritizing humane treatment and access to essential services, the reform seeks to create a more just and equitable system. It's a recognition that health is a fundamental human right, and that everyone, including those incarcerated, deserves the opportunity to live a healthy life.